afternoon, everyone. My name is SHARON Israel. I'm a cardiac physiologist, and today I'll be presenting on the introduction to basic procedures. Okay, so our key learning points today is to recognize the roles of cardiac physiology procedures in diagnosing and managing heart disease, and understanding the principle, indication, and workflow of ECG, stress ECG, and other related cardiac tests. And also, we'll appreciate the challenges and the opportunities of implementing all these procedures in the hospital. Okay, so a quick overview. Cardiac physiology involved the study and the measurement of heart, and which involved the electrical and the mechanical functions, okay? So the test helps clinicians understand that heart problems, and we can detect them and be able to, okay, thank you. And detect abnormalities. So a quick anatomy. The heart is a mechanical pump that supplies the body with blood, and it consists of 2 atria and 2 ventricles. Okay, so the electrical activities begins at the SA node, progress down to the AV node, down to the Purkinje fibers. Okay, so we should understand the metrics. Electrical activities, we monitor this with ECG, and mechanical activities, we monitor that with echo. So some of the procedures include resting ECG, stress ECG, ambulatory blood pressure monitor, and also echocardiography. So a quick one, what is ECG? ECG is a test we do to monitor the electrical activities of the heart, and is a test that is non-invasive, helps in viewing the heart rhythms and also the electrical conduction. So this is the 12 lead ECG, which consists of 10 leads, which is the 6 chest leads and the 4 limb leads. Okay, so how it works. So they've said a lot about ECG today. So it depicts the P wave, the QRS complexes, and the T wave. So I don't need to go in details in that. And it's used, some of its indications used in diagnosing arrhythmias, myocardial ischemias, and also electrical imbalance. So how the procedures work. So first and foremost, when they come in, you explain what the procedure is to them. You tell them what to expect. Some people are already very scared, so you try to relax them and tell them, oh, this test is not painful, and it will even take up to 5 minutes. I think the ECG strip runs for just 1 minute. And then we clean the chest. We try to make sure those that must have used lotion, we try to use spirit and cotton swabs to clean it. Believe me, it helps to reduce the artifacts. Sometimes you'll be seeing some type of artifact that might make reporting this ECG very difficult. Just try that method and you'll see that it helps minimize artifacts. Okay, so, sorry. This is just an image showing how the placement is. Some of our ECG comes with color coding, but some of them are already labeled, so it's pretty much easy. So the V1 is placed on the 4th intercostal space on the right sternum, and just opposite it, we'll place the V2, and the V4 is coming mid-clavicular line, and in between the V4 and the V2, we place our V3. Then the V6 is coming mid-axillary, just at the armpit here, and just in between it, we place our V5. So this is just a pictorial view of it. So moving on to our next procedure, stress ECG. So stress ECG is a test we do to monitor the electrical activities of one's heart while under stress. So is it the physical activities or the pharmacological stress? So how this works basically is we monitor the ECG changes on either treadmill or stationary bicycle, or even with the use of the butamine as our stressor agent. Okay, so some of the indication we use in assessing ischemic heart disease, evaluating exercise tolerance and functional capacity. Some people will come in and say, oh, I don't know if I can tolerate some kind of exercise. So we put them on this, we monitor their heart rate and just see if they can cope with some type of stress. So the procedure is pretty much easy. So first and foremost, before they come in for the procedure, we've given them prior instructions to go through, so they don't take some type of medications, and they don't take things that are like caffeinated, they don't smoke 24 hours prior to the test. And after that, once they come in, they are expected to put on some particular outfits. We won't want them to come in in and be wearing boo gown to run on the treadmill is going to be very detrimental to them. So we tell them the proper outfits to put on. They come in for the test. First and foremost, it's very important to check their vitals before coming in, because we'll not want, for example, elevated blood pressure. If someone's BP is already high, you won't want to put them on the treadmill. So once that's done, for people with hairy chest, we try to shave that part and just clean it with spirit, so that it will reduce artifact. Then we try to strap that on properly. So after that's done, preparing the skin, we attach the electrodes, but before that we do like a baseline ECG. Doing a baseline ECG is very important, because when you want to report distress, you have to compare the resting and the stressed ECG. Okay, so we now attach the electrodes, then we gradually elevate this. So after every 3 minutes it gets faster, and after every 3 minutes it gets it inclines. So that's why it's also important that you check the patients and ask them to also their exercise tolerance level. So it will help you in picking the type of modification you want to use for them, either the modified bruise, the bruise, or even Newton. For the people that are like older age, like from 60, we try to use like a lower one, so the inclination is quite slower than the normal one. So some of the contraindications include acute myocardial infarction, severe aortic stenosis, and uncontrolled hypertension. So for example, this severe aortic stenosis, you know, the aorta supplies the body with blood. Just imagine it's stenosed there, and I'm carrying that patient to put on a treadmill is detrimental. The person could pass out on the treadmill. And also that's why it's very important to have all your crash cards and everything in check, so that once there's an issue like that, you can attend to it swiftly. So please, it's good to go through their record and why they're there for the test. So if you see any of this contraindication, we don't start the test. Okay, so that's the physiologist trying to run the test. So when not to start, uncontrolled blood pressure of 160 over 100 milliliter per mercury. It's very important to check the blood pressure and make sure that if it's here, we don't start. So once we see a blood pressure of 160 over 100, we send them back to the cardiologist and they evaluate their medication. Once this reduces, then they come back for it, because I cannot even imagine someone starting from this place. We won't meet up to their target heart rate or even their meds. So for ongoing symptoms and chest pain, a guest is complaining of chest pain, we don't comment. Abnormal resting ECG and aortic stenosis, like I explain. So when to stop, increasing chest pain. So they're on the treadmill already, or they're using the pharmacological, and they're complaining, oh, I'm having chest pain. We terminate the test immediately. A patient desire to stop. A patient desire to stop cannot be overemphasized. It's like someone on the treadmill is telling you, oh, I'm feeling some type of way, and you still want to. It's good to motivate them, because sometimes some people can just be, I wouldn't say lazy, but yes, they can just be lazy. But you motivate them. But if they are complaining, oh, my leg is paining me, I'm feeling some type of way, we terminate the test immediately. So drop in systolic blood pressure of 10 millimeter per mercury from baseline. That's why it's very important to do your baseline ECG. And also, I did mention, while the test is going on, we check the blood pressure after every 33 minutes. It's very important that you check the blood pressure so that there is no dipping pattern. You know, the normal response to stress is elevated blood pressure, but instead of it to be going up, it's now going down. That's a red flag, and we should terminate the test immediately. Okay, so I'll be talking about the next procedure is echocardiography. It's a sonographic test that we use to check the heart structures and functions. And we have different types. We have the transthoracic, we have the transesophageal, we have the stress. And some of the indication for it, we use it to diagnose valvular diseases, cardiomyopathy, pericardial effusion, and ventricular dysfunction. So this is just me and my colleague performing echocardiography for one of our patients. And this is pretty much easy. So they come in, we explain the procedures to them. We tell them, oh, we need the upper part of their body exposed, and we tell them, oh, this is what to expect, this is not what to expect. They go and lie on the bed. It's very important that when they're lying on the bed, they lie on their left side. It just helps your image to be clearer. So sometimes you'll be having difficulty getting clearer image. Just tell them to lie, put your hand under their head, and you will see that the image will even become much, much clearer. So we try to attach electrodes on their body, because we need a strip of the ECG to be able to do our AFI, that's the strain, and also to measure our auto EF. So we do the manual EF, but most of this machine has like the automated one. So with the use of that ECG strip, we can measure the auto EF from one QRS to another QRS. Okay, then we have the stress echo. This also helps in identifying wall motion abnormalities and assessing ischemic diseases. So types of stress, we have the exercise stress and we have the pharmacological stress. So this is just an image showing a before and after stress. So this is a parasternal long axis and a parasternal short axis view, pre and post. Okay, so what happens most of the time, what we look out for in stress echo is if there's wall motion abnormalities. Some people are on rest, you won't be able to appreciate all those wall motion abnormalities, but once their heart are stressed, we will be able to visualize this properly. Okay, so another procedure which we carry out is the Holter monitor. So these are portable devices that the patients take to the house and monitors the electrical activities for either 24 hours or 48 hours. Sometimes our ECG might not give you everything you need. It's well detailed, but it runs for just 1 minute. And sometimes when they come in, whatever they're complaining of, you might not pick it on the ECG. So it's advised that they fix the 24 to 48 hours device. They take it home, they come back, then we report it. So it's used to detect transient arrhythmias and ischemic episode. So the procedure is pretty much easy. It's just like running the ECG, but the leads are different and we don't put like on the arm like I showed in the ECG. So we have to attach some electrodes, then we strap them on properly. Okay, so and it's very important that after you fix, you give your patients diary so that they can document whatever they felt at a particular time, so that once they're reporting this and you say, oh, there was a particular time I had series of palpitation, they documented, oh, in their diary, this was what happened, this is how I felt at a particular time. Okay, then this is just a pictorial view of Holter ECG. You could see the attachment and how it's being attached. So it's pretty much easy. So once we attach this, we put it in a pouch, then they take it home. So once they go to the house, we can tell them that, oh, you can just remove the bag and keep beside you, because some people complain that it's very discomforting. You can just imagine having this around your neck for 24 hours. So you could just tell them to remove it and keep by the side of their bed. And by the time you're back, you bring it back, they report them, they download it and they report them. So the next procedure I'll be talking about is ambulatory blood pressure monitor. This a device that we use for patients. It monitors their blood pressure for 24 hours. So it's used to assess the night dipping pattern and also the day pattern. Okay, so they fix it for 24 hours. That night dipping pattern is very important because, for example, maybe they have like natural hypertension. It could help in picking a medication or even evaluating the type of medication to use for them, or maybe even the common one, the white coat hypertension. So many people come into the hospital and they say, when I was in the house, my blood pressure was fine. Meanwhile, we're seeing something different. Don't worry, we have a solution for you. Just fix your blood pressure monitor and it will monitor the blood pressure for 24 hours. And as you can see, it's pretty much easy. It's not like the regular, how you wear your regular blood pressure. You have to strap this on properly so that it's not dangling all over the place and it won't be pulling out. So you have to strap this in so that even when they put on their clothes, they can go about their normal daily activities and everything they need to do. Okay, so other procedures include tilt table test. Okay, so this is used to identify syncope and type of syncope, whether it's coming from the brain or it's coming from the heart. And we have cardiac event monitor. So these are like portable devices. This is pretty much like the Holter ECG, but the difference with this is they carry it to the house for like 2 to 3 weeks. So if they feel a particular thing, they attach it. So it's proper to the prep the patient's mind. Oh, you're feeling a particular thing, you wear it on, and it's taking longer readings for like 2 to 3 weeks. Okay, so some of the important in clinical practice, the benefits, it's early detection of life-threatening conditions. I remember like 2 days ago, a patient came in and we did just ECG and we had to activate the cath lab because they saw some STEMI on his ECG. So it's very important in detecting life-threatening conditions. Please, any patient that complains of any particular chest pain or any type of discomfort, it's very important that you run some of these tests for them. So it's also guidance for treatment like pacemaker, hypertension, and angio. So for example, like Dr. Sokol said, if guest has AV block at a particular place, or they'll put pacemaker for them and help with that. So some of the impacts, it reduces mobility and mortality. So time intervention is very important. Little as doing just your ECG, you can save a life, and they will be forever grateful to you for helping them. So integration in hospital settings ensure proper acquisition, maintenance, and calibration of all these machines. You cannot have these machines and keep them carelessly. It will result in you buying and buying and buying. That's why it's very important, once you have these devices or all this in your facility, you try to clean them properly after use to avoid rusting and spoiling. It even helps in reducing artifacts, because just imagine your ECG wires are like tangled and you're trying to do ECG. Then you're not complaining, I cannot even interpret this. Meanwhile, you're not the one keeping it well. So you have to keep all these devices very well. And it's very important for you to train your staff on train staff on technical and clinical aspects. So that's why we host things like this. We teach people what to do, what not to do, what to expect. So you'll be surprised that even down to our front legs, they know how to do ECG, because maybe I'm not there, another of my colleague is not there, and they're running around the hospital. That time they are wasting, they will use it to do something else. So it's very important to train all your staff and to be able to carry out all these procedures. Okay, and it will help your workflow. In fact, if someone can start your ECG before you are raising other tests, it will make workflow very, very fast. Quality control. See my chest. So it's just trying to make them comfortable and relax, so that you'll be able to get effective results in your test. Some systemic challenge: limited access to advanced tools in resourcing and constraint. So some of our facilities are not having like maybe the Holter ECG. I believe some facilities will have like the basic baseline ECG, but for the Holter ECG, they will say it might be expensive and all. So it's very important that you know this. If you cannot access it, we're accessible in CardioCare Multispecialist Hospital. Okay, so this our cath lab. So I'll just be running through that. So we carry out procedures like coronary angiography and PCIs. So this is a video just showing a blockage in the LAD, and the next video is showing restoration after PCI to that vessel. So we carry out procedures like stenting, ballooning, and all device fixing. We also do peripheral angio and intervention. So this was a video showing blockage in one of the arteries there. You can see the arrow pointing to it. So that's our stent going in and trying to open the blockage. Then you see afterwards there's restoration of blood supply. You can see the before and the after. Okay. So cardiac device implantation, like I said, pacemaker implantation, defibrillators, and the rest. So we carry out all that also at CardioCare if you don't have access to that. Also right heart cath. I'm done already. I'm done. Okay, so in conclusion, cardiac physiology procedures are essential tools for modern healthcare. Mastering all these techniques and understanding helps in diagnostic accuracy and patient care. With advanced technologies, this tool will continue to play a very important role in cardiovascular medicine. Thank you.